Good afternoon, and congratulations, graduates, family, friends, faculty, and staff. I'd like to talk briefly about changes in health and public health careers in what I consider to be real time, by which I mean my lifetime and that of my father, who also worked in public health, as Dean Williams mentioned. When my father was born in 1904, a white American male had a median life expectancy of 46.6 years. That is, based on the age death rates at the time, half of all white males born in 1904 would die before they reached 50. By the time I was born in 1937, the median life expectancy at birth was 59.3, a gain of 12 and a half years. I've already outsurvived more than half of the men who were born the same year I was. More recently, half of all white males born in the U.S. in 2013 can expect to live to 76.7 years. That represents a gain of 30 years in life expectancy over the past 110 years. If you do the math, that turns out to be a 2-day increase in life expectancy for every week of the 20th century. Although blacks continue to have shorter life expectancies at birth than whites, they actually have had greater gains over the past 100 years. Life expectancy at birth for a black male born in the United States has increased more than 40 years in the last century. This incredible advance is primarily attributable to improvements in sanitation, nutrition, the environment, and preventive approaches such as immunization, which have had major impact on child mortality and thus overall life expectancy. The striking advances in medical care, such as antibiotics and transplants, have had much smaller impact. Is it possible for us to add another 30 years to median life expectancy over the course of the next century? I'd rather doubt it, unless we can find new means of preventing the deterioration of health as we age. Turning to global health, there's been a dramatic change in the last 30 years in how we think. It used to be, how much can we do with what we have? Now the thought is, how much will it take to do what we need to do? This remarkable change has been the result of several factors, including a fairly dry thing, the World Bank's World Development Report 1993, which for the first time showed finance ministers around the world, the ones who control things on wheels. The folks who control money, it showed them that investing in health is good for development. There have also been the creation of global initiatives such as the Global Polio Eradication Initiative, which is now nearing its end. We have had only 7 cases of polio anywhere in the world thus far this year. The Global Fund Against AIDS, Tuberculosis, Malaria, and Gavi, the Vaccine Alliance, which have brought hundreds of millions and billions of dollars to bear on problems in the developing world. And there's also been the entry of new players in global health, such as Rotary International, which 30 years ago made a commitment to support global polio eradication and has so far put more than $1 billion where its mouth is. It has also put hundreds of thousands of Rotarians in field situations working in countries. And the Bill and Melinda Gates Foundation, which provides a couple of $1 billion a year worth of support for health development in developing countries. And finally, there's been the development of a new area that's called pharmacophilanthropy, as exemplified by the Mectizan donation program, in which Merck, a major pharmaceutical manufacturer, has made an open-ended commitment to donate as much ivermectin, Mectizan, as necessary for as long as necessary to get rid of river blindness. And this has meant a several $100 million commitment over the course of the last 30 years. And the International Trachoma Initiative, in which Pfizer donates Zithromax to prevent blinding trachoma. Now, these changes don't mean that we have everything we need, but it demonstrates that the resource pie is not nearly so constrained as we used to think it was. So let me turn now and talk a little bit about public health careers. When my father was born, there were no schools of public health in the United States. Harvard opened in 1913 and Johns Hopkins in 1916. Today, There are more than 100 members of the Association of Schools and Programs in Public Health, with more than 59,000 students, of whom about 40% are bachelor's level students. And when I got my M.P.H. 40 years ago or so, there was no such thing as a bachelor's degree in public health. 47% are master's degree level and 14% doctoral level. Many of you may know or know of Bill Foege, a true public health hero. I can't tell you how excited I was last year. Bill was the speaker at Emory's Commencement. And on the subject of life plans, Bill said the following, and I quote, "When I was your age, everyone was telling me to develop a life plan. My advice? Avoid a life plan. You cannot imagine what will be invented in the future. You cannot imagine the opportunities that will be presented. You enter a world of infinite possibilities, confusing ideas, and continuous changes. But a life plan will limit your future." Now, this was a great relief to me, because my life plan to date has been something on the order of find something you like to do and keep doing it until you're offered something better or told you can't do it anymore. Now, each of these has happened to me more than once. I became part of CDC's Epidemic Intelligence Service in 1965, intending to do my 2 years government service and then return to be a hospital-based infectious disease specialist. I was assigned to the California Department of Public Health. On the first day I arrived, in the afternoon, I drove out in a state car and in rapid succession investigated an outbreak of waterborne gastroenteritis in the Central Valley of California, California's first case of human plague in 15 years, 2 cases of botulism associated with home canned tuna, an outbreak of tuberculosis, and I spent 5 weeks in Honduras investigating a polio outbreak and helping to organize a campaign to vaccinate against polio. This was so exciting and so joyous, as well as affecting more people than I could ever hope to in a hospital setting, that I never again thought about returning to clinical medicine. So for the past 52 years, I've been in public health, and I have identified what I believe to be the 4 most important characteristics of a successful public health worker. I take knowledge and intelligence for granted. So the first characteristic is optimism. You've got to be an optimist to be in public health. You've got to believe that things can get better and that you can help them get better. If you're not an optimist, maybe you ought to consider a different career choice. The second characteristic is collaboration. Public health is a team effort, and we must be able to work together smoothly. An important contributor to successful collaboration is ego suppression, by which I mean making sure that others get the credit they deserve rather than focusing primarily on yourself. The third characteristic is flexibility, resilience. Things won't always go our way, and we got to be able to roll with the punches. Along with flexibility, a sense of humor is critical. We're doing serious work, but there's no reason we can't enjoy it and have a good time while doing it, and I hope you do. And the fourth characteristic is the willingness to accept indirect gratification. I'm convinced that my work has resulted in thousands of deaths being averted. However, unlike in clinical medicine, I can't point out or identify a single one of the beneficiaries. We often, in public health, don't work in direct contact with those we serve. So it's important that we always are able to see the faces behind the figures that we deal with. So in conclusion, over the past several years, when younger people have asked me for career advice, I've said there are 4 criteria for having a good career. First, find something you like to do. Second, that you're good at. Third, that helps others. And fourth, puts food on the table. And if you meet those 4 criteria, you'll have a good career. With the possible exception of being good at what I do, I've met those criteria and have had a good career. But more recently, Mark Rosenberg, who until recently was the CEO of the Task Force for Global Health where I work, has convinced me to add a fifth criterion, which, if met, means you'll have a great career. And the fifth criterion is working with people you like to work with. I've been blessed to work with people I like to work with, so I guess I've had a great career. I trust each of you will also. Thank you very much.
Congratulations to my fellow graduates. We did it. And I'd also like to give a huge thank you to the faculty, family, and friends who are here today and have been so supportive of us throughout all of these years of school. For me, what stands out most about my experience at UGA and in the College of Public Health specifically is the community and camaraderie I found with my fellow students, professors, and administrative staff. My first undergraduate class was an FYOS with Dr. Luke Neer. I walked in with about a dozen other wide-eyed freshmen not sure what to expect in a college class. Dr. Neer quickly made everyone feel at home with a one-page sheet of questions to fill out about ourselves. He then had us go around and share a few of our answers so that we could get to know each other. By the end of the semester, I had changed my major to environmental health based both on the content of that class and the supportiveness of Dr. Neer as he encouraged everyone to explore and pursue what they were interested in. Since public health classes mainly consist of small group discussions, I've gotten to know my fellow classmates as well as my professors while sparking my scientific curiosity. Some of my closest friends in college I've made in my major classes and mutual suffering through organic chemistry. M.P.H obviously has prepared us academically through the many papers, projects, and fieldwork we've done in our classes. And while maybe not a course objective, M.P.H has also given us a safe space to ask questions, a network of support to go after your goals, and introduced us to our colleagues, mentors, and friends. I'm not sure about all of you, but I'm much more nervous about the next chapter of my life after college graduation than I was about high school graduation. In the past 5 years, Athens has become my home. Have an advising question? Go to Dr. Zamiri. Need help collecting money for an EHS Club t-shirt? See Betsy Bush, one of our EHS administrative assistants. Nervous about going to a non-public health club event? Don't worry. Despite being a small college, there will probably be at least one M.P.H student there. Need help with a class? Set up a study session with your cohort that will quickly turn into socializing, but leave you feeling better knowing that you're in it together. Need help with literally anything else? Find Heather McEachern in Rhodes Hall, and if she doesn't know the answer, she knows who will. I found the only better place to study than the SciLi is Carnegie Library on the Health Sciences campus. Agua Linda is obviously the best place to get a cheese dip and burrito after a long week. I figured out when it's faster to walk or to take the bus during that short 15 minutes we have to get across campus between classes. And for that matter, I finally figured out the family housing bus route. Despite being worried about the large student body when I started, UGA has become comfortable. I've found my people. Nevertheless, after today, we are all headed our separate ways. The class of 2017 will go on to be doctors, nurses, health educators, epidemiologists, biostatisticians, environmental health scientists, social workers, and policymakers. We can take what we've learned and the sense of community with us. We can still find our people, the people who, like all of us, care about a healthier population, and even if in a small way, want to make the world a better place. So I wish you all good luck, and again, congratulations on this major accomplishment. Just remember, stay connected with your friends here. Post life updates on Facebook for all of us to like. Get your flu shot, and go dogs.